everyone. So April is Adrenal Disease Awareness Month. So I figured I'd do a video about my adrenal insufficiency. My name is Michelle. This is my YouTube channel that I'm using to document my journey fighting stage 3 metastatic triple negative breast cancer and now central adrenal insufficiency, which was caused by the immunotherapy Keytruda that we used to fight the cancer. So I am currently still in cancer treatments. I have not had another immunotherapy treatment since November. It's April now, so 5 months. But I do have, again, a diagnosis of central adrenal insufficiency. So I wanted to talk a little bit about what that means and what the different types of adrenal insufficiency are and give you a little bit of information on that, especially since it is Adrenal Disease Awareness Month. So I have some paperwork here, and what I'm going to do is show you this. So this is from the Adrenal Insufficiency Coalition, which is adrenalinsufficiency.org, I believe, yes. And so this is they have a booklet. It's like 30 pages long, but I printed out just a couple of pages of this to talk about the different types of adrenal insufficiency. And so Addison's disease is primary adrenal insufficiency. And that is where the adrenal glands themselves just atrophy. It could be usually autoimmune, but the adrenal glands shut down. Secondary adrenal insufficiency is where the pituitary gland stops producing the ACTH hormone, which tells the adrenal glands to produce cortisol. And then tertiary adrenal insufficiency is when the hypothalamus does not produce the CRH hormone, which tells the pituitary to produce ACTH, and then that tells the adrenal glands to produce cortisol. The effect of all three adrenal insufficiency types is that your body doesn't have sufficient cortisol or even any cortisol in its system. And cortisol is produced by, this is just another page here, cortisol is produced by the adrenal glands. And if we don't have cortisol, also there are other hormones that could be involved in adrenal insufficiency. Aldosterone and other androgens, other hormones as well, are also produced in this HPA axis. But cortisol is the one that we're most concerned with because that's the one that we can replace, and that is the one that is really required in order for us to continue living. And so if we do not have enough cortisol, we need to replace it for life, or we are not going to live. If your adrenal glands are working normally, then any physical or emotional stress that happens, your body produces cortisol to cope with that. It's what gives us our fight or flight response. And basically what happens is if we don't have that cortisol there and we have a stressor, our body doesn't have anything telling it to fight. And so it's kind of like, okay, well, I guess we're going to die now. That's what it felt like when I had my adrenal crisis. And so any sudden emotional or physical stress, any kind of trauma or treatment or illness or anything can potentially require us to need to supplement additional steroids into our system, hydrocortisone or prednisone or dexamethasone or something, to combat that so our body can continue doing the things that we need to do throughout the day. If we don't do that, then we can go into what's called an adrenal crisis, and that is a life-threatening situation. It can be fatal. It requires emergency treatment. This is the toolkit for the newly. I'm going to go back to that in a second. I just want to go back here. So just to highlight again, in primary adrenal insufficiency, the adrenal glands are affected. Cortisol is low. ACTH usually is high because if the adrenal glands are not producing cortisol, then the pituitary gland is producing more and more and more ACTH to try and stimulate those adrenal glands. So usually that would be an indicator on a blood test. Also, electrolytes are off, and would require primary Addison's disease requires both cortisone and aldosterone supplementation. Secondary and tertiary are treated the same way. I have, and they're collectively known as Central Adrenal Insufficiency, the HPA axis as a whole, HPA axis as a whole is what is affected. The pituitary gland, my pituitary gland doesn't produce the ACTH, so therefore my adrenal glands are not stimulated to produce cortisol, so I need to replace cortisol. My sodium and potassium are relatively normal. My sodium has been on the low end of normal if I don't keep up on my electrolytes. So that's why I drink my Element electrolytes every day. I have 2 packets a day in my 40 ounces of water each time. And it is, my sodium is fine as long as I make sure I'm hydrated, at least so far in the winter. We'll see if I have to up that in the summer. There can also be other hormone deficiencies. I did test low on DHEA, which I am now also supplementing, and I do find that it is helping. I have temperature regulation, which could be related to this. It could be related to supplementing steroids, and it could be related to just the fact that chemotherapy has kind of put me into menopause. So, but I do find that the symptoms of hot flashes and night sweats are improved on the DHEA, at least so far. So that's good. All right, the next page here, we have some symptoms of adrenal insufficiency. So things that were kind of, indicators: severe fatigue, lack of energy or stamina, weakness, loss of appetite, weight loss, anorexia, nausea, vomiting, diarrhea, stomach or muscle or joint pains. Also back pain is a symptom. Low blood pressure, dizziness, blackouts, fainting, salt craving, fast heartbeat, and skin hyperpigmentation. It does say that this is only, these here are only for primary, but when I was, before I was diagnosed, but when I had symptoms, so basically when my adrenal glands stopped working, I did not have vomiting, but I was on anti-nausea medicine with the chemotherapy, because it happened in conjunction, while I was in chemotherapy. So, but I definitely was sleeping 18 hours a day. I had absolutely no energy to do anything at all. I had no appetite at all. Lots of stomach pain, muscle pain, joint pain, back pain. I did not, don't think I was checking my blood sugar that particular couple of weeks, but my blood pressure was consistently very low. It was in the hospital during the adrenal crisis after a liter of fluids was 88/37. It was very low, and it was in the 90s for those whole 2 weeks. I was craving salt. I did have a fast heartbeat. I was dizzy, and I did faint at home, which was what sent me to the hospital in an ambulance, and that's how I was diagnosed. Adrenal insufficiency can also cause irritability, lack of concentration, memory impairment, confusion, apathy, and depression. I can tell you that now, if I start to get stressed and I do not take additional hydrocortisone, I will get very grumpy for no reason. Everything will irritate me. So that is now one of my first signs, and I've started to be aware of that. Lack of concentration for sure. And then when I was again in crisis in the hospital, my blood pressure wasn't coming up. The emergency room doctors were looking for all of the things that an emergency room doctor would look for that would cause my symptoms. So they weren't really paying attention to the fact that my husband was saying that I was suspicious of having adrenal insufficiency, and they hadn't given me the steroids yet, and I was just laying there feeling like I was leaving my body, and I didn't care. So that apathy and depression certainly was evident at that time in a crisis state. So out of the way. So let's go back to this kind of toolkit for the newbie. And I just wanted to point out, like, you know, when I got this diagnosis, I didn't really know anything about what it meant. So, but what I know now is that I have to take hydrocortisone every day. Any stressor, any physical or emotional stress, I have to take extra. And I'm still in cancer treatment. So I've had to raise my dose of steroid replacement on a daily basis while I'm still in radiation. So never abruptly stop. There is no fixed regimen. So we have to manage the amount of medication we take based on how we feel. There's not a blood test like a diabetic might have. We can't check our cortisol level to see if we need more. There's no set number. It's different for everybody. And so it's very nuanced, and that makes it really difficult initially to get used to living with this. But it does get easier. So if you're newly diagnosed, it does get easier. You start to notice those little things like, gee, I'm really grumpy for some reason. Maybe I should take an extra 5 milligrams. Also, other prescribed medications can affect the metabolism. So if you're on a different medication for some other condition, you need to watch that as well. We have stress. There are some rules from both this Adrenal Insufficiency Coalition and the National Adrenal Disease Foundation, which I have their chart as well. So we'll just talk about stress dosing in a second. This is just very general. It talks about, you know, sick day dosing and stress dosing, any illnesses, injury, surgery, any mental stress. It's different for everybody. Low cortisol symptoms. Over time, you're aware of your own signs, and everybody's an individual. We need to learn how to give ourselves emergency injections, and I'm going to talk about that and show you what's in my emergency kit in a second. We also need to inform medical personnel. So I need to wear a medical ID. I have one on each arm actually when I'm out. So this is my bracelet that has, on the underside, it has some information there about adrenal insufficiency, and it says 100 milligrams hydrocortisone, and it has my husband's phone number on it. And the other one is on the side of my Apple Watch, and it says the same thing. And so it has my name, my husband's contact info, and it says 100 milligrams of hydrocortisone because that is the emergency dose. If I am ever found unconscious, I need that amount of hydrocortisone as a minimum. So you want to be prepared and have an emergency. You have your medical ID on, have an emergency kit with your injection with you, and also some emergency medication tablets in your emergency kit. And so I'm going to show you my emergency kit in just a second. Finally, I just want to say, you know, you need to be your own advocate. You will walk into an emergency room and they will have never seen someone with adrenal insufficiency, and they're looking for, you know, an aneurysm or a heart attack or an internal bleed somewhere. And so you want to make sure that you are advocating for yourself and saying, I have this condition and I need emergency care immediately. And so stress dosing, I'll just show these two. So this is the Adrenal Insufficiency Coalition stress dosing. A lot of these are exactly the same. Mild injuries, exhaustive or physical exercise. If you go on vacation and you're walking a lot more than normal, you probably have to updose. Any illness, any injury, and same chart, but with NADF, the National Adrenal Disease Foundation, has the same things. Illness with fever, physical or emotional stress, any kind of dental work, a colonoscopy, chemotherapy. My endocrinologist has been very involved in that. Anything with anesthesia, they should be doing with IV hydrocortisone, and preferably in the hospital as well, not as an outpatient. Okay, and then let me just, put this here, and I'm going to show you my emergency injection kit. Let me just move those out of the way. This is couldn't show that yet, so that'll be at the end. Okay, so I have 2 emergency injection kits. I have this big one here that I had in my hospital bag, and I kind of keep it in that hospital bag just in case if I ever do need to go to the hospital in a crisis. Sorry, this is gonna fall. Then I have something to take with me, and it'll end up being like my carry-on bag if and when we travel as well. So this is a little bit bigger kit. This one is goes into my purse, and so it fits into my pocketbook nicely. Now, before this, I rarely carried a pocketbook. I don't like to carry things with me just all the time, everywhere I go, but now I need to carry this with me everywhere I go. So this goes into my pocketbook. And so they're identical as far as what's in them. So I'm just gonna open this one here. The first thing that's in there is actually this. So this is the NADF emergency card that says adrenal crisis alert. Basically saying if the person in possession of this kit is found unconscious, they need this injection, and that's what's in here. And so it has the symptoms of acute adrenal failure, chronic symptoms of Addison's disease, and it also has emergency room protocol. Start an IV of saline immediately, draw your blood sample, and then immediately administer hydrocortisone right away. Also in here is a form letter from the NADF website, which says, what is an adrenal crisis? And it's a letter to emergency room staff. And on this letter, it has my information filled out here, my name, my endocrinologist's name and phone number, my husband's name and phone number, and my address, so that they have all of that information. If they have my name and my address, and it doesn't have my date of birth on it, I'll probably put that on there, because if they have my name and date of birth, they can get into my chart and they can see right in there that I have adrenal insufficiency and any type of emergency requires immediate steroid replacement. So that's in there. The next things that's in here is the injection. So I have 2 of them in here, and I have 2 of them in here. So this is Solu-Cortef, which is 100 milligrams. It's an ectovial, which means that there is powder and there is saline. You have to squeeze it together and shake it and constitute it, basically. And also in here are syringes. So these syringes I have 2 of them, obviously. I have 2 injections. And so I can use, and I have some alcohol wipes in here as well. Mix up the Solu-Cortef, draw it out into the syringe. Even if it's expired, it's still okay to use, because it is super critical that I get the medicine in if I am in a crisis or if I'm unconscious for any reason. So then I would swipe, if I was conscious, I would do this myself, but generally it probably would be someone else doing this. They would be able to just swipe an area with the alcohol prep and then inject that medicine into, it could be either IM or IV. If someone is giving me an injection, especially not a medical person, then they would be giving it IM. So they would just stick it into the thigh or the stomach or the arm. There's also an instruction sheet with pictures on how to do that, that I have right on the top of this as well. So that's the emergency injection part. Let me put that back so it's on the outside. And then the other thing that fits very nicely in here is this little pill container. And I have one in here as well. Open it up, and there's this pill container. In the pill container, I have extra steroids of many different dosages. And so if I open this up, you can see that I have hydrocortisone 5, 10, and 20, dexamethasone 1, 2, and 4, and then I have Zofran, which is an anti-nausea, because if I am feeling nauseous, I want to try and get the oral meds in so that I don't need to give the injection. Because if I vomit, that means I cannot keep the oral steroids in and I need to use the injection. So I do have Zofran in here, and I also have the Toprol, which is the beta blocker that I'm on in here, just so that all of my prescription medications are in one convenient place. So that is my emergency kit. This is something, again, I need to carry this everywhere I go. Oh, and just, this is the other thing I wanted to show you. So this is a little chart that was also on the Adrenal Insufficiency Coalition website that talks about the different types of steroids. And so I have hydrocortisone and dexamethasone. I do not have prednisone. I haven't been on that, but I just wanted to show you the different dosages. So 5 milligrams of prednisone, again, I don't have that, but if we look at cortisone, I guess that's a different brand of cortisone. Oh, cortisone acetate. Okay, so hydrocortisone or Cortef, that is what I have. So 20 milligrams of hydrocortisone is equal to a little bit less than 1 milligram of dexamethasone. Hydrocortisone lasts in the body 8 to 12 hours. So the half-life is less than that. It's 4 to 6 hours. And dexamethasone lasts 36 to 54 hours. So during radiation, I was supplementing hydrocortisone. I found I was needing to take extra about every 3 to 3.5 hours by the second week of radiation. And so what I did is my endocrinologist switched me to dexamethasone, 2 milligrams in the morning, and that lasts throughout the whole day. And then around 3:30 in the afternoon or so, I will take a little bit more hydrocortisone. I'll take 20 milligrams if I have something I need to do that night, but usually it'll just be 10 just to get me through the evening. So that's that. And then, oh, again, I gotta put that like that so it doesn't fall. All right, and then there are a few other things. There's another, this is just a different, the Adrenal Insufficiency Coalition has its own little doctor's note, which is actually a little bit easier to read. So I think I'm going to replace the one I have from NADF just because it's, I don't know, I have to read it through. It's longer. The NADF one is like 3 pages long and it's folded into these emergency kits. This one is just 1 page. So I printed this out actually because I want to fill out my information on here and have this like not even in the kit, but in my wallet, like readily available for travel for, you know, if I go anywhere. So this doesn't even need to be opened for them to see that there is a medical issue that requires immediate attention. And then the other thing that they have at adrenalinsufficiency.org are these emergency cards. And so again, this is something, it's not a wallet size card, but it is something that you can put, you know, just in your purse or, you know, even fold it in half and put it in your wallet. It'd be probably in 3s. And so that's it. That's the management of adrenal insufficiency and, you know, the medical emergency kind of side of things, making sure that that's all covered. I will be looking into, once I'm through the cancer stuff, I will be looking into getting and training a medical alert dog to alert to low cortisol. And it's a little tricky. Again, it's not like diabetes where we can test the cortisol and know that it's low. I do happen to know that my morning cortisol is very low before I take my meds. So I think that it will work to get samples first thing in the morning to train for really low. The nuance is training for when it just starts to dip low, because we can't afford to risk a crisis by withholding medication just to get samples, especially when we can't test it. And it takes about an hour for oral meds to kick in. So if I start to feel low and I take more hydrocortisone, it's 45 minutes before I start to feel better. And so I don't know exactly what that's going to look. Obviously, I will be documenting all of the training of any service dog that I happen to do. For those of you who don't know, that is my trade. That is my profession. I am a certified professional dog trainer and have been for almost 30 years. So it is in my wheelhouse, but I have not trained alert dogs before. So that part is new to me, and it's also very close personally. So it's a little bit harder. So I'm consulting with other trainers that I happen to know who do that. And, that's something for the future. It's not anytime in the next, 4 or 5 months, because we're getting through the cancer first. I will link in the description both of these websites, the NADF website and the Adrenal Insufficiency Coalition, as well as Team Addison Canada. Jill Battle is awesome. For those of you who don't know, I've been on the Pickle Jar Podcast a couple of times with her, and she has, especially in Canada with free shipping, she has emergency cards and lots of information kits that she can send you. In the United States, there's a shipping fee, but I'll link to her website as well, so that if you did want to get any of those laminated cards, you can do that. Everybody have a great day. One more thing I forgot to say, I also keep a little pill container on my keychain that is extra hydrocortisone. It's just 10 milligram tablets of hydrocortisone, so that I always have these if I do start to feel a little low. Like, my keys are in my pocket, even if my pocketbook is not right on my person, I have this with me, like if I run into a store or something. So, well, I guess I would probably bring my pocketbook into a store, but sometimes I don't. So this is my other little secret. And I have like 4 of these little pill containers. And so I used to have 2 on my key ring, and I lost one somewhere. So if anybody finds a purple one near me, it's just hydrocortisone, nothing exciting. See you later. Have a great day.